Good morning, everyone. I'd like to welcome you to the Psychology Department's 15th Annual Mental Health Program. Before we begin, I'd like to give thanks to Professor Kara Williams for helping co-host this event, and thank you to the Psychology Department for their continuous support. Thanks to the IT Department for helping host our program again on WebEx. Perhaps next semester or next year we'll be live in front of an audience again, where we can again record these. Again, a huge thank you to Dr. Walter Franzek and the Liberal Arts Department for supporting us throughout all these years and bringing this event onto campus. And finally, again, thank you to our presenters, Courtney DeCarlo and Kelly Olenski, for accepting our invitation to be this year's speakers. A small final thank you goes out to a dear friend and colleague, Sue Chuddy. I don't know if she's in the audience, but if she is, again, Sue, thanks for connecting us with Courtney and Kelly. We really do appreciate that. Our program is going to take about an hour and a half. And towards the end, Professor Williams and I are going to take questions from the audience. And we ask you that you add them to the Q&A box to the right of your screen. Well, we ask that you hold your questions till the end of the program. As I mentioned, our department has been hosting these programs for 15 years now, and we try to find different topics addressing mental health every year. And we hadn't covered anxiety yet, and we thought it would be a timely topic given the difficulties that so many people have faced in the past 2 years. So just to give you an idea, a study was just published out of Boston University that found a 110% increase in anxiety amongst college students between 2013 and 2021. And that's a big increase. They mentioned depression too, that has increased by 130% among students. And so there might be a consistent pattern with other colleges too. So our hope is that Courtney and Kelly will share their expertise about this phenomenon in addition to what we can do to manage our anxiety as well. So should anybody in the audience experience difficulties during our program, our presenters are going to provide us with resources in our area that you can reach out to. And if you're a Moraine Valley student, we encourage you to go to Moraine's Counseling Center. Make an appointment today by calling 708-974-5722 or walk straight to room S202 in the S building. Courtney DeCarlo is a licensed clinical professional counselor in the state of Illinois. She's been working in the field of psychology since 1998 in a variety of settings, including community mental health centers, hospitals, and private practice. Courtney co-founded Oswego Wellness in 2014 and has since provided outpatient therapy for adolescents, adults, and couples within the practice. She specializes in marriage and family struggles, depression, anxiety, OCD, phobias, crisis intervention, parenting, life transition issues, adolescence, and LGBTQA+ areas. Finally, Courtney has trained in multiple settings, such as the Behavioral Therapy Training Institute, and uses various treatment modalities, such as cognitive behavioral therapy, ACT therapy, exposure response prevention therapy to help her clients live more rich and fulfilling lives. Kelly Olenski is a licensed clinical social worker in the state of Illinois with specializations in mental health, children, and families. Kelly began her career working in several social service agencies with children and adults with autism and intellectual disabilities, in addition to community mental health centers, the American Red Cross of Greater Chicago, and at Linden Oaks, Edward, and Elmhurst hospitals. In her current practice at Oswego Wellness, Kelly works with individuals across the lifespan. Her primary goal is to connect with individuals to support them in living authentically. She has training in providing DBT, ACT, CBT, experiential, expressive, and trauma-informed therapies. Kelly also uses various therapeutic interventions in her practice. She has experience treating individuals struggling with life transitions, grief and loss, anxiety, mood disorders, trauma, personality disorders, self-injury, eating disorders, and substance use. Everyone, please join me in welcoming Courtney DeCarlo and Kelly Olenski.
Well, first off, I just want to say thank you for having us and inviting us to share our knowledge in treating anxiety. It's literally my favorite thing to treat. So I'm excited to, walk you guys through some of the information that we have and answer any questions that you might have. So as we go through, the whole point is understanding it and managing it. So anxiety 101.
Well, we start off with this quote, and I know everyone can probably read this screen, but I'm going to read it along with you. It says, saying you don't have mental health issues is like saying you don't have medical issues. Even the healthiest person gets a cold from time to time. Mental health works the same way. We all face challenges in life that impact our mental health. Everyone has mental health, and everyone's mental health matters. And we really start off with this quote in particular, because we really want to normalize what we're talking about today. Just like you go to the doctor or the dentist to take care of different parts of your health, addressing and talking directly about mental health is just as important. And it's not specific to certain types of people or groups of people. It is everyone. So everyone has mental health. And so hopefully everyone will learn today how to better manage certain parts of our mental health.
So I know I can't see all of you right now, but so for those of you watching, I just kind of want you to take a moment to reflect on the top 3 things that you can think about that are impacting your mental health right now. And there might be some overlap and there might be some outliers of things that are really specific for you. But just take a moment to think, identify, you could even write them down. And then I want you to also consider and reflect on, how do you know that these things are impacting your mental health? What are the signs, the symptoms? What's the evidence in your life that you can see that these things are having an impact, a negative impact?
All right. And then, like we said, like Courtney said, take a minute, think, ideally jot them down, because we're going to come back to those in just a few minutes. But without further ado, we'll take a test, which for some of you might trigger your own anxiety. But this is hopefully a pretty easy test. It's a standard true false. And these are definitely some things we're going to address today as we kind of move throughout our presentation. So first and foremost, again, you can either write your answers down, think of them, whatever works for you. But first, true or false? Only some people have anxiety. Kind of already mentioned that one, but number 2, anxiety only impacts your mind. 3, anxiety is all the same. 4, anxiety always has a trigger. And finally, anxiety can only be treated with medication. So I see different answers popping up in that chat. And I'm seeing a lot of people say false. Yes, all false. So hopefully this was a fairly easy quiz, but we put it in here because some of these statements, right, are things that we have heard of, things that people have maybe told us or shared with us. And so today we want to debunk a lot of the myths around what anxiety is, how it's treated, what we do with it. And so we'll kind of move through each of these things as we kind of present today. All right. So first and foremost, what is anxiety? And so I've mentioned a few times, especially as we talked with that quote at the beginning, we all have mental health just as we all have anxiety. It is a normal emotion that we're all born with. Literally from the minute we're born, we experience anxiety when we're kind of thrusted into the world. We need to find food. We need to find care and shelter. And so even little babies experience it all the way, of course, as we know, throughout the lifespan. So it is a normal emotion we all absolutely have to have. We need it to survive.
As Nick kind of pointed out, that I work within an ACT framework. And so when we have clients come in and they say, I just don't want to feel anxious, a common ACT response to that is, well, that's a dead person's goal, because we actually need it.
Yes, absolutely. So the second one says, like, serves to increase awareness, alertness for self-protection, right? When Courtney and I were talking through this presentation, we kind of talked about the example, like if you're crossing a street, for instance, and you hear car horns blaring coming from maybe off to your left, if you don't have anxiety, you're not going to look and see, oh, I didn't notice that that car is coming as I'm trying to cross the street, right? So we need that to be able to jump out of the way. However, the anxiety that we'll talk about today and managing it and all of that is when these normal emotions start to cause difficulty in our life. And that's usually when anxiety is too frequent, too intense, or a combination of both. And oftentimes, right, it doesn't necessarily have to have like a specific trigger or stressor. Many types of anxiety do, which we'll get to. But oftentimes, anxiety is a physiological, mental, emotional feeling that we might have that we really can't put our finger on. And we'll talk about that as well.
One other thing to mention is that sometimes they're tied to rational stressors, the anxiety that we're experiencing, and a lot of times it's tied to irrational stressors. So being able to identify the difference between those two.
Now, I know I'm not a huge social media, but I know on Instagram I see a lot. That's the one I am on. I see anxiety, stress, burnout. I see these kind of buzzwords out there. And so I included this slide, or we included this slide, because we wanted to sort of pick apart what those different terms mean. So we talked about anxiety. It's a normal emotion, all born with it. It could get out of whack. Stress. So what is exactly stress? And these are moments of a heightened response to any situation, positive or negative. We talked about, little babies being born. If you have children of your own, or if you, maybe have a family member who's had children, that that's a really great stressor, but can come with a lot of stress. Going to school can cause stress, even though it's what we call eustress. It has positive and pleasant emotions tied to it as well. So stressors are anytime our body and brain get that heightened response. And again, it could be something external, like an event happening around us. It could be something internal. But stress is that response. Now, we know over time that lots and lots of stress and anxiety lead to this constant pattern, which leaves us feeling, here we said the word exhausted, burnt out, perhaps. And that's where we kind of throw that word in, burned out. That is really that prolonged exposure to several stressors, maybe ones that don't produce lots of positive emotion or pleasant emotion, corresponding increase in anxiety and heightened state of anxiety over time. With any big emotion, positive or negative, pleasant or unpleasant, our body sooner or later is going to come down and crash. And that's where we get this term burnout. That sustained feeling over time just leads to that burned out, exhausted, done kind of feeling. To stick with the theme of school, and probably where you guys are at right about now with finals versus that syllabus week, you'll notice throughout the presentation we include lots of memes. Humor definitely is a coping skill for sure. But here we have a young, spry looking Mr. Barack Obama during syllabus week. And then we have him at finals week, which is probably a good representation of how many of you might be feeling right now. Just sort of done. And again, that's because we know semesters are weeks long, lots of sustained attention needed.
So briefly wanting to go over some physical symptoms of anxiety, because I think a lot of times I actually have to coach clients when they come in. Where do you feel it in your body? Teaching them that mindfulness aspect of, well, I just feel anxious. But where do you carry it? Like, see if you can locate it. And they usually can. So it creates, like you can have chronic headaches if you have chronic stressors or anxiety. Lots of muscle tension and backaches, lots of gastrointestinal issues. If you are really elevated, you can have like that shallow breath, your heart rate increases, your blood pressure goes up. Again, really elevated, like presenting sometimes, you might be shaking. It's like the number one phobia. So, and then again, if it's really chronic and we're not getting a reprieve, you're going to notice some more significant changes like appetite, weight, sleep, and just chronic fatigue. Another meme with Michael Scott. We have to include Michael Scott. I am the Michael Scott of my practice. So Kelly's laughing because she knows it's true.
I love it.
Then of course there's the mental and emotional symptoms that correspond. So we have excessive worry. So worry is usually like kind of about the future. Rumination is maybe like looking back and like, why did I say that or do that? Or how could I have screwed up so badly? We have difficulty concentrating, that restlessness. We tend to avoid things that make us anxious. And the more and more you avoid it, the more you reinforce that I can't tolerate it. Again, as we look through this line of symptoms, progressively they get worse. Maybe you don't bathe as much. You're feeling hopeless because you're not getting that reprieve. And then your functioning at home, at work, at school can start to decline.
Mhm.
And gym helper,
Yeah.
of course.
And then, of course, so like we said, anxiety over time, intensity and frequency can lead to what we call the big stuff. And these, speaking of like avoidance, right? These are often things we don't necessarily want to talk about because they are very big. But it's something that we add here because it is worth addressing. That anxiety over time can lead to some pretty big things: substance abuse, self-harm, suicidal thoughts, harm to other people. Eating disorders. I particularly like to address that one, especially with the college age population, because we do statistically see an uptake increase in eating disorders amongst college students in particular. School avoidance. So what that might look like for you guys: not showing up to class, not doing assignments, just sort of avoiding altogether. And then, like Courtney was saying, this often leads to that general inability to function then, not only at school, but it could be at work, at home. Maybe we go home and we're just done and we are in our room then for the rest of the evening or day. So it leads to some pretty big stuff. And then what types of anxiety? Like we mentioned earlier, we could have specific triggers to them. We include this because what we're really trying to sort of explain is that really there's over a dozen diagnosable forms. Every couple years in our field, they come out with a book that tells you all the different kinds of diagnoses there are out there. And in the most recent edition, they have over a dozen. So anxiety, there's not one face, so to speak, of anxiety. The most common are these four here: general, so a daily kind of sense of anxiety that plagues us day to day; panic. Those are the ones that when we think of anxiety, we think maybe panic attacks and that traditional, very physiological response to anxiety. Social, being in social groups, social settings. We know too, Courtney and I are talking through this presentation, and we had thought of the increase of social anxiety with the pandemic, being away from social crowds and social situations for a really extended period of time. Folks who maybe entered that period of time not necessarily having that anxiety are coming out now on the other side of things with a little more than they had going in. So that's a very real form of anxiety as well. And then, of course, like we've mentioned, those specific phobias, presentations, perhaps, everything from, I don't know, bugs, spiders. Courtney deals a lot with those types of things.
Vomiting.
That's always on blood. Very specific triggers.
I also think that social media lends itself to a lot of that social anxiety. While you might not be diagnosed with social anxiety disorder, it's created this kind of situation where most of our interactions are very cultivated. They're not face to face. And so the worst fear a teenager might have is like having an awkward encounter. So like they think they're going to die if that happens. So teaching them that, like having face-to-face encounters and having it be awkward or go awry is it's not going to be the end of you.
And we do know that there are certain risk factors that sort of predispose us to anxiety. Genetics, so if there's a genetic component; family history; biology, so how our brain and body are made up; childhood experiences. We separate those from the word below, trauma. Childhood experiences could be a variety of things. We're learning more and more every day of how those experiences impact us long term. Things like moving as a kid, moving multiple times, if you had a chronic physical illness or mental illness, if your parents did, or a sibling, if your parents got divorced, all of those experiences could influence us.
If you were bullied.
Yeah, that's a great one. If you were bullied, all of that can sort of impact us down the road. Then we have what we call like the capital T traumas. So those are either single incident or chronic multiple incident events that certainly influence our brain and body. Physical health conditions. There is actually a big correlation, for instance, between thyroid and anxiety and depression. Oftentimes, if we have folks that are new to us and we're sort of doing an initial assessment, we might ask, when's the last time you had things like a blood work panel done and testing that thyroid? Because we do know when there's thyroid issues, that could increase anxiety. Other mental health conditions, we call this comorbidity is the fancy word, but basically meaning, maybe if I have a depression diagnosis or depressive symptoms, anxiety or something else could correlate there. Substance use, not necessarily abuse, but we do know that folks who use substances, especially more frequently, have greater instances of anxiety. Lifestyle, the foods we eat, the way we move our body, the content that we watch or read or take in, and social demographics. We do know that anxiety varies based on race, gender, sexuality. Different social demographics are more prone to anxiety statistically than others.
One thing to mention too, because I'm assuming that the majority of these people watching are college students. Well, college students are very obviously known for using a lot of substances. And if you're anxious and you're using substances, especially alcohol, it can feel like a coping mechanism, right? So it numbs you. It's like other than sleep, I can't think of anything that's more of an avoidant activity. However, the problem with that is that the number one withdrawal symptom from alcohol, which it could even just be a nasty hangover, is anxiety. So you become like a dog chasing your tail. You think you're fixing the problem, but then the next day it's exacerbating the problem.
I will say too, that's also a common withdrawal with cannabis use as well. So, prevalence. So we said, like we said before, and we've hopefully driven home at this point, everyone experiences anxiety. However, of all Americans, since we'll go with that, who has a diagnosable anxiety disorder? So 19% of us here in America have a diagnosable anxiety disorder. Personally, I think that's underreported. There's folks that maybe don't access treatment or have the ability or for whatever reason aren't specifically diagnosed. But at least from what we know, 19% of us have a diagnosable anxiety disorder. So that translates to about 40 million people here in the United States, which is more than the entire country of Canada. And what was really nice is there was a meme that went with that one, but yeah.
Like it matches exactly.
Right.
But the underreporting isn't necessarily it might be just people who got kind of white knuckle through it, but I think for OCD, the average length of time for an accurate diagnosis is between 7 and 12 years. So someone could have OCD for almost a decade before it's accurately diagnosed.
Mm-hmm.
So returning back to those stressors that you identified, and I think I asked you to do your top 3, I want you to take a look at them again. And looking at them is probably going to spike your anxiety again. But I want to know what you've done that has been helpful to cope, and maybe write down a couple of the things that you've noticed have been helpful. And then, just because I know how we're all built, I want to know what's been unhealthy. I think I skipped a screen. Oops. No, okay. And then also what has been unhelpful to cope, because as humans, the way we're built, we do a little bit of both. So this kind of illustrates that. Sometimes I exercise, and sometimes I meditate, and sometimes I just throw kerosene on my problems and make them worse.
That one's always my favorite. I listen to music. What kind of music? The worst sad music I could ever listen to. Okay, that's not helpful.
Yeah, rap.
Yes, rap music.
So Kelly's going to break down one of our, when we talk about, since we're gardening.
I love it.
So when we talk about coping mechanisms, one of the Kelly's sweet spots in the practice is exercising mindfulness. And so she's going to really break it down.
Mm-hmm. So yeah, mindfulness, especially because I think nowadays, again, going to our pop culture, it gets a good and bad rap as far as what it exactly is. So yes, what we see is images, maybe people meditating, yoga, all that. all amazing forms of mindfulness. But today we're going to learn what mindfulness actually is, definition wise, and a simple way we can practice it without any fancy equipments, without having to really do much of anything but sit here. So we'll get to that. Ooh, there we are. So what is mindfulness? Mindfulness actually comes out of ancient practices. I could get super nerdy and talk all about how it's a Buddhist practice, or it actually comes from many different religious backgrounds centuries ago. But a man named John Kabat-Zinn, who came and kind of studied with folks out east, came back here west and founded the Mindfulness Center, I believe out east somewhere. I want to say MIT or Harvard, and came up with a structural definition. It was Harvard. Of course, smart people out there. All right. So what is exactly mindfulness? Mindfulness, he defines, is paying attention. So that's the first step. We have to pay attention, which sounds easier said than done, but how many times do we find ourselves maybe drifting off? So paying attention to the present moment. So not maybe what happened 10 minutes, weeks, months, years ago, or what is going to happen in perhaps 10 minutes, hours, days, months, years in the future. We're here right now. And on purpose. So this is an action we're throwing our whole selves into. We're being purposeful here. And we're going to be curious when we practice mindfulness and non-judgmental. So what does that all even mean? Did you have something to add to that definition?
I was just going to say to you, what happens if I get distracted?
Awesome. Well, we're going to try this here, but you should get distracted. You will get distracted. That's how our brains work. Our brains are these really beautiful, probably the most beautiful part of our body, but they really are always going and going and going. So mindfulness is this very intentional practice to slow them down and simply bring them back. And when the brain and mind does wander off, I use a metaphor like a puppy dog on a leash. You just simply guide it on back. No big deal. We're training our brain, and it definitely is a training process.
So the training the puppy back strengthens the practice.
Absolutely. Yeah. All right. So we're going to give it a go, because mindfulness is this topic that we could talk and discuss, but I think really you got to do it. I love this little lemur guy. It's probably my favorite meme on the internet. All right. So come on, inner peace. I don't have all day. So like we said, today we're going to do a simple exercise. And will you be like a Zen master after this? Probably not. And that's okay. Because for instance, I love this stuff. I've been doing it for years and I'm nowhere near that. But what is it? So first and foremost, wherever you're sitting, if you're cross-legged in a chair or on the floor, laying down, whatever, first, we're just going to simply get comfortable in the most comfortable position that you can without falling asleep. And so for most of us, we're sitting. So that looks like feet flat on the floor. If you have a chair back, your back is straight up against the kind of back of the couch or the chair or seat that you're sitting in, and you're sort of flush with your legs against that chair. And we do this because we'll talk about anxiety as far as like tension in body and stuff oftentimes leads to this like hunchbacked position, which makes breathing and deep breathing really difficult. So you really want to sort of sit up straight, align that spine. And once you're seated in this very comfortable but upright position, this exercise is all we're going to do is take 3 deep breaths. And again, sounds very simple, but if we're being curious and non-judgmental and we're really present, what we'll notice is when we're breathing and taking a deep breath, there is so many things we can focus our attention on. We can notice air coming in through our nose and our mouth. We can notice it maybe in our sort of sinus cavities, nasal, into our throat. When we're doing these types of mindful breaths, what I encourage folks to do is we call it belly breathe. I work with kids, so we'll call it like belly breathing. But really what we're doing is called diaphragmatic breathing. And it is a type of breathing we don't do throughout the day, simply because we have to move and groove. And most of the time we don't stop and take these really big breaths, filling up our entire lung. So what happens, whether we're anxious or not, is by nature, we're really taking these kind of shallow breaths all day. So whether you're anxious or not, just stopping and taking a really deep diaphragmatic breath once in a while is good. Again, body, mind, all of that stuff. So I'll count us in with 3 deep breaths. I'll count them one at a time, and we're going to go slow. And what you'll focus on is, again, all the different aspects, breathing in through the nose or mouth, feeling it fill your lungs, your belly expanding out. And then when you breathe out, that your belly contracting, the air coming back up out through your nose or your mouth, the feeling maybe in other parts of your body.
So that's before we begin, one thing I want you to really do quickly is just kind of scan your body, see how it feels right now. And then I'd like you to do that again after we're done. And then I like to close my eyes when I do these because I can focus and nobody can see you. So go ahead and feel free to close your eyes. And one easy way to make sure you're doing belly breaths is putting your hand on your belly so you can make sure you can feel it contracting and expanding and all that.
Awesome. And then when you notice, because it will, your mind start to wonder, ooh, I'm hungry. Oh, how many breath counts are we on? Oh, crap, I forgot I have to turn this in or whatnot later today. Just bring that puppy dog right on back to what we're doing, which is breathing. All right, here we go. So everyone sit comfortably, get ready, and we'll take our first breath in and out. Second breath in and out. And last breath in and out. And as Courtney was saying, if you sort of notice any changes in your mind and your body, even with just 3 simple deep breaths.
I know I do. I'll be curious to hear if you guys do too. All right, so why mindfulness? And I think a lot of people think about mindfulness and they think about like Buddhism or some hippy dippy kind of BS, but there's a lot of research actually that supports mindfulness. So as Kelly was talking about, Kabat-Zinn created the mindful based the MBSR. It's like an 8-week program, and they did a lot of research at Harvard to see what would happen if they implemented, I think, periodically throughout the day. They'd have like 15-minute increments of mindfulness. And so they wanted to see what would happen with people's brains. So they would do MRI scans pre and post these like episodes of research. And what they found is it literally changes the architecture of our brains. So when you do this as a habit, what happens is like your frontal lobe, the part that is responsible for decision making, for emotion regulation, for learning, memory, compassion, empathy, that thickened, which means it grew stronger. And then they looked into the area, the amygdala, which is kind of the fight or flight area. It's responsible for stress, anxiety. It becomes enlarged in PTSD patients. It shrunk. So it actually creates changes in your brain. And these that research has been expanded beyond just that study. So as a result, it's really kind of incorporated in almost every therapeutic orientation there is, and it's even like in medical interventions in the medical field with chronic pain, they'll incorporate mindfulness because it's so extraordinarily helpful.
Yeah, absolutely. So other than deep breathing, right? How else do I do this? Like I said before, we see kind of stuff out there of, I have to meditate and breathe and yoga. And what I like to say is anything could be a mindfulness exercise or a mindfulness practice. We can literally, it's less a thing to do, like a checkbox, versus a way of being, right? And again, like we are all kind of puppy brained, so we all get off course at times. But mindfulness, again, is that gentle pulling back to the present moment. So how do you do this just day to day? Well, first and foremost, mindfulness is basically noticing things. Again, there's that curiosity, being that detective kind of in your own brain, in your own body. And we can notice versus react to maybe frustrating feelings, anxiety, sadness, even happiness and excitement and joy. And just basically being attuned to, oh, what is that? What is going on here? And then when those things maybe create urges within us to react in ways that are unhelpful, we can kind of play that tape forward. Or at this point, we maybe have, 20 plus years of doing the same thing over and over again. We can stop that from happening, pull it back and notice instead of just reacting of every time maybe I get anxious, and I could feel that anxiety build, right? We might get snappy, and maybe we might snap on someone we love and care about, and now we got a whole problem and a conflict and everything else to deal with. Whereas we could take a step back, be mindful of that feeling, and choose to do something else with it, and we can be more preventative or responsive than reactive to it. Courtney mentioned before that technique called body scan. And so this is something just like kind of stopping and taking those big diaphragmatic belly breaths throughout the day. We can also stop and say, okay, what's going on with my body? And almost like a MRI or X-ray machine, I like to at least start with like my head and kind of scan down. Oftentimes I will do a lot of noticing around like shoulders and upper back. When we're anxious in particular or stressed or just kind of moving fast throughout the day, this tends to be where we hold a lot of stuff. It's a very defensive posture to kind of turn in like this, right? Like we're ready to go. So just the simple act of being able to locate that tension and even just straighten and release even can do wonders for, again, mind body with just feeling relaxed. If we're not necessarily super anxious or sad, we all kind of tend to do the hunchback thing. Noticing our heart rate, noticing our breath, our body temperature. Here we are again, choosing to regulate our own breathing. So whether that is just those slow 3 deep breaths, if you have like one of those like Fitbit watches or an app, which we'll get to at the end, there's different ways to do breathing. You can do it in different counts of like 3, 4, 5, whatever it might be. There's different techniques with that. We call it breath work. And then there's one we can use our senses for. You'll notice the word here, grounding. Grounding is a fancy way to basically say bringing us back to the present moment. And so one skill that we teach folks is something called 5, 4, 3, 2, 1, and basically matching up the numbers with one of your senses. So for instance, noticing perhaps maybe 5 things I could see right here, right now. And then moving down to 4 things I can feel right here, right now. 3 I can hear, 2 I can smell, 1 I can taste. Kind of however that might work. If you're maybe at a restaurant, you might say 5 things I can taste. It's a flexible skill to use, but the purpose again is to use that sensory experience to bring us right back to the present moment. It really grounds the brain here and now. And then another word that we often use a lot in therapy, and one of my favorite words is acceptance, right? And Courtney kind of alluded to this earlier when we were talking about OCD, anxiety disorders, and how we kind of treat those. And one of the real big things that we work with folks on is, this desire to not feel anxious ever. Like we said, never going to happen. So how is it that we can accept our emotional experience, accept maybe feelings of anxiety or sadness, and work with that, right? Instead of always trying to avoid it or maybe numb out on it or stuff it away or pack it away. How do we move towards greater acceptance of that? And mindfulness can help, because when we're aware of what's going on within us, brain and body, it helps that acceptance process move along.
Yeah, I think the acceptance piece, like we have clients that come in, they're like, why would I want to accept feeling bad? I'm like, because you're a human and you're going to feel bad sometimes. So what happens is you're struggling with it so much. And when we struggle with it, what we do is we actually artificially heighten the feeling. So we do what we can, like I think we talk about in the next slide, the serenity prayer concept. But at the end of the day, there might just be some residual not great feelings. And so acceptance and mindfulness actually can help you behave and react more effectively in your life while not feeling great, which are really important skills to have as adults and at all ages, really.
I had a college student once share a metaphor with me. He came up with it, and I thought it was pretty awesome. Where basically, when we build like a wall around ourselves mentally, and we try to ward off all these negative or uncomfortable emotions like anxiety. And he said, Kelly, when I do that, anxiety goes away for a minute, but it comes back with more friends and tries to get over that wall, and eventually it does. Because believe it or not, yeah, avoiding an emotion never makes it go away ultimately. All right, so more, what can we do? I like this meme. It was like the Disney version, the adult version of Let It Go. So again, staying present. Our brains love to wander to the past and to the future. We like to plan, and we like to use the past to, think that we're going to learn for the future. But ultimately, more often than not, we end up being stuck in the past or too much in the future. And reality says all we really have control over is here and now. So again, we can control our attention. It is definitely a training process and a practice. Like if you ever had a puppy, again, I use that metaphor a lot because it is this process of training and going over and practicing and practicing and practicing. Other skills that we teach, one is called diffusion, which basically is creating space between maybe you and that thought or that stressor or that thing that creates a lot of anxiety for you. So if the thought is maybe I'm not good enough, for instance, right? Oftentimes we attach to that thought and immediately have this response of anxiety, shame, guilt, whatever. Diffusion says, okay, so if we're fused to that thought right now, body and mind, what if we created some space? And one way we do that often is changing the narrative in our head and saying, I notice the thought, I'm not good enough, right? And now it becomes one of the millions of thoughts we have a day instead of something that we have to believe and go forth with and create all that yucky emotion.
And I think you can, on your own or with, a therapist who practices in this way, really learn the skill of diffusion. It doesn't make it go away. We don't need to. So I think the way that even the English language is built is like, I'm sad. No, you're not sad. You're having a feeling of sadness. I'm irritable. Nope, you're having a feeling of irritability. And so I always use the metaphor, ACT therapists love metaphors, but it's like wearing sunglasses, and that's like your lens. We'll just take them off and put them in your fanny pack. They're still with you, but you're not so connected and fused to it.
It's like that dad joke, like, I'm hungry. Hi, hungry, I'm dad. Like, no, you're not hungry. Like, yeah. And then big picture, that's another big one, right? Expanding our perspective. Oftentimes, anxiety loves what we call rigidity, being stuck and fixed and focused, which is a great skill to have sometimes. Again, anxiety can work for us, but oftentimes will work against us when maybe perhaps we're so caught in the details of something that we really have to zoom out. I work with a lot of college students around, like, for instance, like grades or classes or assignments, and we get so focused and stuck on maybe that one assignment that I'm like, whoa, zoom out, look at all of the work that you have done throughout this entire class. Like, is one assignment really going to make or break us here, or one class even going to make or break us, right? Not to say throw it all away, who cares? But again, kind of zooming out and looking at the big picture can certainly help decrease some of that anxiety. And then again, learning to take all of that stuff and then sort of just mentally try to let it go and let it go and let it go again and again and again and again and again. So when we have a good grasp of mindfulness, we throw in there a little self-care, which again, we'll kind of talk through what that exactly means. And it leads to this fancy word called emotion regulation, which is, again, a fancy way to say, basically kind of having an ebb and flow throughout life, where life isn't necessarily so like intense anxiety and then, oh my gosh, like an intense low, and we're kind of going this really insane roller coaster. Mindfulness and self-care skills together can lead to more of a balanced state. So one of my favorite quotes by Dr. Seuss about basically how life is really day-to-day this balancing act.
So, listed some examples of healthy self-care. I think that we have to always remember that this is really based on, it's very you specific. So there's things on here that I don't necessarily connect with. I haven't played a video game since 1989. But I think video games in moderation, but we can go through a few of them. I mean, I think exercise for me is one of my favorite medicines, that the endorphins that it produces, connecting with the people that I love, walking my dog, it's like a shot of dopamine. You get fresh air, you get some exercise, and maybe you're walking with your family, so you're connecting with them. So you're doing like multiple things all together. I think that there's a lot of interesting ones in here that I don't know if we always think about as self-care, but boundary setting in relationships is very challenging sometimes for some people. Intentionality with time is also very challenging, but can really make a difference in improving your functioning, and also asserting yourself, saying no when you want to say no and when you can say no. But at the end of the day, so values-based living is like figuring out what matters to you and including some aspects of that in your life. I really quickly will just, they did a study on, it's an ACT study, of course, but they went to like a rehab facility where it's filled with people with chronic pain. They're getting PTOT, speech, they're miserable, they hate it there, the food sucks. And so they did like a depression inventory, anxiety inventory, life satisfaction inventory, and then pain inventory. And then they asked them like, well, what matters to you? I like gardening, but I can't do it anymore. Or I like to hang out with the grandkids, but they wear me out and then I feel bad, physically or whatever the thing might be. Or I like music, but I don't feel like listening to it lately. So then they implemented all these values-based living ideas with all the patients in the study. And at the end of the study, they redid all the inventories. And so depression decreased, anxiety decreased, and life satisfaction increased. Can anybody guess what happened with the pain levels? Kelly already knows the answer. No, they went up. So they were in more pain because they're doing more things, but they're engaging in life in a way that matters to them. And so ultimately that's, I think worth the extra pain.
All right. So in an ideal world, we'd all live in this super balanced, amazing state. However, we are human and that's not going to happen. Neither for Courtney, not for me, not for anybody. Things are going to go whack. So what do we do then? So then we go back to what I like to call like the basics. And basically what ends up happening is when we are in what we call like a level of distress. And I like to kind of help folks think of this as like a thermometer or a ladder. Using the thermometer sort of metaphor, this is when things are kind of hot with our emotions, like we're in that hot zone. And we really, a lot of the like self-care skills and things like that we've talked through, mindfulness and all of that, really help when we're like lukewarm or even just like cool as a cucumber, things to just kind of practice to keep us there. But when we're hot and life is like, woo, all of those sort of skills are not necessarily going to be the most effective and helpful at that point. So we got to go to the basics. And one of those is self-soothing. Now, of course, there's multiple ways we can do this that are not effective. But there are ways we can use self-soothe skills that are effective. And again, this is something that we've been doing since we were born. So what does this look like though as an adult? Basically doing anything to kindly engage our five senses. So what I will ask folks to do immediately when they come and start seeing me, no matter what age, I say, okay, so what do you like to do to self-soothe? What's healthy, maybe what's not so healthy, we'll put those aside, and build really like a self-soothe kit, one that you could maybe keep at home, definitely one that goes on the go with you to school, work, wherever, and include things in there that will engage your five senses meaningfully. Things like your favorite flavor of chapstick, things like really awesome smelling hand lotion, right? That is both a sensory like feeling, but also smell. Putty and fidgets are really big. Candy, mints, gum, things that make you happy and smile, pictures of loved ones, cat videos. We'll talk later about too much time with technology, but again, in that crisis mode, that hot zone, have a special kind of board saved on Pinterest, Instagram, YouTube, whatever, and pull that up and have that be your go-to. Music, for instance, create a kind of calm down playlist on Spotify of your favorite songs, not ones that are necessarily sad or angry or that are going to encourage the emotion, but one that will sort of help bring it down. Memes, things that make you smile.
So when Kelly talks about the ladder or the thermometer, this is where we really want to use these skills to prevent probably some self-sabotaging or self-harming kind of behaviors, or those negative coping skills that are going to just kind of reinforce not feeling well. So these are sort of a way to like bring you down so that we don't engage in that self-sabotage being.
And then, of course, ways to healthy distract, right? So self-soothe is kind of one skill that I teach folks as a go-to. Distract is the other. A lot of times some of us have this mentality of, I have to like, white knuckle my way through it and grit and bear it. And that's not necessarily true. We don't necessarily want to avoid everything altogether, but taking a 5, 10, 15-minute break and doing something with that break, of course, not just sitting there and thinking and stewing and ruminating, but doing something healthy and effective to be able then to return back to maybe class or the conversation with my loved one or the boss or customer at work that's really, grading me today. That is going to be obviously more helpful than just leaving the situation entirely. So healthy things to distract, again, a healthy activity. A lot of these do look similar to the self-care list, but again, we're engaging them in a very different way. Again, we're using that, like Courtney's saying, to come back down and maintain kind of that baseline, so to speak, that ebb and that flow. One that I also teach folks that's based on a lot of physiological science, actually out of the scuba diving community, believe it or not, is one called TIP. TIP is an acronym. You'll notice we like a lot of acronyms in our field. And the T stands for temperature change. So again, what they found is when scuba divers would plunge, naturally, their heart rate would slow, their breathing, their respirations would increase, decrease, they'd be, kind of calming down naturally. And the reason is because they were being like submerged in cooler water as they descended. So how does this look? Can't just all jump in and scuba dive somewhere when we're feeling anxious. What this might look like, though, is kind of in the movies, you might see people splash cool water on their face. You can put your hands or your wrists under cool water. I had one person who worked at like a Jewel, and they would go in like the refrigerator box in the back and kind of take a few deep breaths in there. When the weather's cooler, we can go step outside and kind of, again, breathe in that cool air, basically changing our temperature, kind of shocking the system a little bit. Intense exercise, believe it or not. So this doesn't mean you have to go run a marathon. Then you definitely, you'll have different problems, that's for sure. You'll have different things to worry about. But you can go do maybe some jumping jacks, go up and down the stairs at your house a few times, run in place really fast, but run around fast around the block as fast as you can. Again, Courtney and I were going through this, and I had to laugh because Courtney said, you definitely won't be thinking about what was making you anxious if you go out and sprint as fast as you can. Very true. We talked about the paced breathing before. Again, 3 deep breaths, breathing in maybe groups of, I teach a lot of folks what we call 4 square breathing, breathing in for 4 counts, holding for 4 counts, breathing out for 4 counts, holding, and sort of continuing the square. And then pairing that with muscle relaxation. So what that looks like, for instance, simply put, is we can breathe in while kind of tensing a muscle group, namely our hands is always a good one. And then we relax when we breathe out. And that, again, creates this mind-body connection of really just calming our body down, the tension, the quick breathing, all of that.
So just briefly, the different treatment options for anxiety. There's different types of therapies. There's lots of different types of therapies. If you go on like Psych Today, you're going to see people who specialize in all sorts of these acronyms, and you're not going to know what any of them are. But CBT, DBT, ACT, and ERP are really probably the most evidence-based for anxiety. And for a lot of other diagnoses. That doesn't mean that supportive talk therapy isn't going to be helpful. And all therapy is sort of client-centered, meaning, it's about the connection and the relationship. But these orientations are going to teach you some skills that you're going to need to bring with you out into the world, outside of the office. There's medications, there's support groups, and then there's structured programs. Without going into great detail, that's what, if we break these out, that's all the acronyms, it kind of teaches you what they are and what their aim is. And basically there is a lot of overlap there with all of them. And sometimes it's more appropriate to use DBT, which is Kelly's specialty, than ERP. Like if a patient is unsafe, it's probably not a good idea to use ERP and make them feel really uncomfortable, because if they don't have emotion regulation and they do harmful activities and I make them feel uncomfortable, what are they going to do? They're going to hurt themselves. So we kind of work on assessing that. Briefly, there's just kind of like, this is a progression of treatment options, and outpatient therapy is the start. And There's really not ever like a time to know that for outpatient therapy. It's like never going to hurt to go and try a few sessions. You're not committing to sitting on the couch for 10 years. Sometimes it's just like 6 to 8 sessions, and we resolve the issue, and then you can come back for booster sessions if you need to. We can also utilize medication evaluations in psychiatry. That's something that should be probably done maybe even in the first session. The therapist might recommend it, but it may be something that we add to the toolbox after like 20 sessions and we're not seeing much improvement. There's group therapies. We have tons of groups in our office. Our practice likes to run groups. There's support groups that you can find online, or maybe some in person in your area. When your functioning starts to become impaired, that's when you kind of need a higher level of care. So we look at hospital-based options, like there's a half-day program, IOP, and a full-day program, which is PHP. That's where you're going to go. It's like your job to take care of your mental health, and then you go home at night. If you're ever imminently at risk of hurting yourself or someone else, or you're just really not able to take care of your needs, you might want to go into patient. Inpatient, if people are not familiar with it, it's not kind of like what you would see in the movies or what you historically might have thought about it. The average inpatient stay, I think, is only 3 to 5 days. It's just to sort of like stabilize the crisis and make sure you're safe. And then we send you to PHP or IOP or wherever you need to go for like more of the bulk of the treatment. Residential is like long-term, usually like a 30-day program, and that's where people need to go when they kind of need to like reset their brain. They need to be immersed in a place where it's constantly reinforced and all of these skills are augmented all the time. There's a lot of support, and so that's usually where you go after you've tried treatment a couple times and it's not sticking once they get back out into the real world.
So to sort of summarize the different treatment modalities, a kind of alphabet soup, so to speak, all these words we've kind of thrown at you: acceptance and distress tolerance, which is that kind of term behind cooling down the thermometer, so to speak, exposure. We've kind of thrown that term around, meaning, again, being kind of like exposed and kind of facing that thing that makes you anxious. So what is all of this to sum? Basically, really the concept of managing and treating anxiety, whether you are doing this, again, in a therapeutic setting, whether you're kind of doing this at home through your own mindfulness, self-care type work, is basically learning to realize that we can experience anxiety and don't necessarily have to do anything with it. Obviously, if it gets too intense, we can kind of bring that back down, which is that distress tolerance principle. But basically that we can be anxious and basically be okay. Sit with that anxiety, move through that anxiety, and still function and be productive with that intense emotion.
So if you see, they all marry well together. A lot of therapists who use these orientations will kind of dabble in all of the above. And the core feature is teaching you how to tolerate uncomfortable feelings and not to struggle with them, because that, again, like we said, that artificially heightens them. And then if we struggle or avoid, then we never learn that we can live a full and meaningful life, even feeling anxious sometimes.
So again, what do these look like in real life? We mentioned earlier that serenity prayer, but basically the gist behind that is, right, for those that might know it, learning to accept the things that we cannot change, which honestly is a lot of things, and then learning to sort of change the things that we can change, which oftentimes is really our response to things. Maybe there's a few situational external factors around us we can change, but a lot of times it's moving in that place of acceptance and really owning and doing the work that we need to be able to live and move forward. Again, making room for these feelings, kind of normalizing them, even when they don't feel comfortable. We like to use a weather metaphor that basically we are that nice, beautiful, bright blue sky, and clouds may roll in, tornado might roll in, a hurricane might roll in, but at the end of the day, we are always there and we are there. And these things are just passing through. We can tolerate our mistakes and imperfections. I say that word as I made a mistake while saying it. There we go. Learning to sit with that, right? Going back to these principles of being enough, being imperfect, kind of acceptance, sitting with the uncertainty, right? Those are really hard things to do. We might need to use some of those skills to help cool that thermometer if we're sitting here anxiously waiting about, will I pass class? What will that look like?
Will we finish this on time?
Will I finish this on time? Will we have enough time for questions? As you can see, like we're picking up the pace here. Valued living, and whatever you choose to do, it has to be for you, right? So just because we see something else or we hear something else might work for someone else and we give it a try and we're like, oh, this isn't working, I don't like it. That's a good indicator. Hey, let's try something else. And that's okay.
Last but not least, just really briefly going into some of the common anxiety medicines. And then again, these are, neither one of us are medical doctors or prescribers, but we just, being in the field, know that these are the most commonly used. So if you do get prescribed something, you would be likely an SSRI, like maybe Zoloft or Prozac are the most common two, I would say, for anxiety. If your doc gives you benzodiazepines, it's usually pretty rare and it's short term. It's more frequently they're giving beta blockers. So like propranolol, it's a blood pressure medicine, and all it does is physiologically just kind of bring your blood pressure down and your heart rate down, and it's a little bit sedating, but it's not habit forming. Benzodiazepines are a controlled substance, and so we want to, as a field, move away from them. And they also are an avoidant behavior because then you're just sedating your anxiety. And then there's lots of different, like, just sort of natural things we can use. And then, of course, like Kelly said, if you do see a prescriber, one of the very first things they're going to do is they're going to order blood work, because they're going to want to make sure that there's not some underlying medical reason, namely your thyroid, because that's the most common. So that's it in a nutshell. I have at the end here some local treatment options. Our offices are in Oswego and Plainfield, so we really wanted to kind of focus on your geographical area. So these are hospital-based programs, and like Linden Oaks in Mokina has, I'm not familiar with all, I know Silver Oaks also has the IOP, PHP, so they all have different versions of the same stuff. Again, there's some community mental health. So the difference between some hospitals, your insurance is kind of a piece of the puzzle, but they can help navigate it. Once you get into the system, they're going to help you navigate, like where you can go, what services are provided. But the community mental health is for people who maybe have no insurance, or they have maybe Medicaid, because not all places accept Medicaid. Here are some outpatient and for like medication management, and there's some even just like like Maslow's hierarchy of needs, food and shelter. Those are real stressors. I mean, like those, we need to address those probably before we would address anything else. So if that is an issue for you, there's some resources for that as well. And then just some websites that are helpful to go to. A lot of these NAMI and there's like local NAMI chapters that have meetings. I know Linden Oaks and Naperville has meetings, but you can probably find one that's closer if that's too far. And then just some other, again, websites that are very helpful with resources. Mm-hmm. So we are at the question portion, and I know we went through those resources quickly, so hopefully, Nick, you can provide that with your students, so that if they do need resources that are local, they can, will they have the slides?
Yeah, you sent me the slides yesterday and I appreciate it. If anybody would like a copy of these slides, feel free to email me at Shizas, SHIZASN2 at morainevalley.edu. But before we go into our Q&A, I pulled up a sound here.
What sound is that?
Applause.
Oh.
Yes. Sounds like burning fire. No. But this is an amazing presentation. Thank you so much for sharing your expertise with us. I mean, you gave us a really well-rounded picture of anxiety with the factors, the prevalence, the signs, the treatments. I mean, you gave us some really great suggestions. I mean, I love how the program focused on primarily on like the practical exercises that we could use. That was one of the most helpful things. So, absolutely. Thank you again. We're gonna open up, as we said, for forum for Q&A. Professor Williams, Professor Carrie Williams and I are gonna be taking the questions. We'll kind of take them back to back. And Kara, I'll start with one, and then if you want to start with one, I know Shania had asked a question for our panelists here in the chat. So if you guys have questions, if anybody has questions, please enter them into the chat box below on the right-hand side. And then if you don't mind sending it to everybody and not just to me and Kara, we'll be able to kind of see them, and then our panelists can see them too. All right, so our first question, there was one question before Shania's that talked about diet, but I want to make sure that we get to Shania's question. That's a pretty poignant one. How do you practice diffusion when you are minoritized in a society and have to interact with racialized people and systems that really exacerbate your anxiety?
Well, I think that's definitely a consideration. So we're talking, this presentation is really focused on anxiety and treatment on a micro level, but you're right, it didn't really kind of factor in on a macro level how, culturally speaking, how to incorporate diffusion while being inclusive of that. Do you have anything to speak about that?
I mean, that's absolutely that's always a tough one, right? Because as a society, we wish we could diffuse from a lot of different things. On a macro level, though, what I've worked on with a lot of folks is diffusing from those belief systems, like internally, right? Because that's a huge factor. Is that a lot of the things that we get kind of fed and shared throughout our lifespan end up becoming our own inner monologue. And that's really the starting point with a lot of people I work with, where we begin, is how do we sort of deal with that and diffuse on an internal level. But you're totally right, it is a challenge.
So yeah, diffusion is really like an individual, like where it's our own self-talk, our own narrative. Diffusion, if I don't know if she could be, was it Shana?
Shania.
If Shania could be more specific with her question, like if she's looking for a skill set in an environment where she feels marginalized, or how would that work?
It's got to be, that would have to be tough to always, to always be on guard and always, have to set your boundaries with people and, let them know that you're feeling anxious, or, so it's got to be a difficult struggle on a daily basis. But thank you for attempting to answer the question. Maybe Shane can give us some more insight. Kara?
Mira wants to know if you have any recommendations for books on cognitive behavioral therapy or research studies.
Just CBT?
Oh, I have to look up the name.
There's about
that was her. Yeah, her question was about CBT.
Okay.
There's the feeling. I want to say it's the Feeling Good book. Hold on, I'm making sure I got this right for you. Feeling Good book. Yeah. So the person who writes these books is David Burns. And if you get it, it's a thick book, but it's each chapter is very specific to maybe different thoughts that we might be working to change. But yes, it's called the Feeling Good, and it's a handbook. And I've used that a lot with folks. Like I said, it's a thick read, so if you buy it, you're kind of intimidated by it, but you can really kind of pull and piece chapter to chapter.
We own that in our library downstairs.
We do. I think I added that one. I like that one. That's my CBT reference.
But I think if you go to Amazon, there's also a ton of workbooks which are really interactive that will incorporate CBT and mindfulness, or ACT and mindfulness, or the self-compassion workbook. And all of these things I think are helpful to like augment let's say you're in therapy, that you can do those exercises outside of therapy so that it's really implemented. It's just not 1 hour a week. So we use a lot of workbooks here. If anybody's curious about ACT and learning about that, there's a book called ACT Made Simple. And it's awesome. I recommend it for
I have it. I have it.
You have it? Okay.
Yes, I do.
It's good, right? It's good
good.
personally, it's good
It's awesome.
professionally. And it's deceptively simple because it's based on really dense theory that relational frame theory, which you don't even need to know all of that and read all of it to be able to implement ACT effectively.
It's applicable with a lot of populations. I had used it at one point with a population that had anger management issues.
Totally.
Mhm. Alexander asks, would a poor diet also be considered a risk factor or part of a lifestyle risk factor?
100%. I think when we put on the self-care, healthy self-care, we put nutrition. So like my three favorite foods or medicines are food, exercise, and sleep. And so, if those things are off, you're not going to feel well.
Thank you.
Okay, we have some questions about ACT, like if it would be useful for treating trauma, ADHD.
Yeah, and somebody else had something similar, Kara. No. Go ahead. This ACT question is a different one than you asked.
I don't know if I would use ACT immediately with trauma. There's probably more evidence-based treatment interventions to start with. And then once you've gotten through working through the trauma, then yes, ACT would be wonderful. But there's like prolonged exposure is usually one of the number one treatment modalities for trauma. But I would probably, because there's just, again, like I said, there's more evidence-based treatment protocols for that, for trauma. For ADHD, I don't also, I'll say professionally, I don't work with a lot of ADHD people. I do know that they have a hard time sometimes focusing on some of the concepts. And so we have some other clinicians here who are like gurus and teaching skills and how to manage the time and things like that. ACT would be helpful for self-compassion and for some acceptance around, okay, this is the way my brain works, and and being okay with that. Like my brain doesn't have to work like your brain. But in conjunction probably with more skills-based stuff. Does that make sense?
Yeah.
Anna J asks, how long does anxiety need to be present to be considered generalized anxiety disorder? I can answer this from the DSM, from what I teach in class, and from my own training, but I'll leave it to our panelists.
No, you can take it.
I know the answer.
I know the answer.
Let me pull up my DSM.
6 months. Minimum of 6 months. Although generalized anxiety disorder can last a lifetime, but the minimum qualification is 6 months, almost every day, nearly all day, at a mild level. I mean, one of the, you think of a radio dial. Like I think of panic disorder as like the radio dial gets turned up to 10, full blast for 10 minutes, 12 minutes, and generalized anxiety disorder, certainly the volume kind of, is volatile throughout the day, but sometimes at a 4, sometimes at a 3, sometimes at a 5. It's like a mild level that's always kind of there. But 6 months is what I would say, unless you wanted to add anything more to that.
Do you have the DSM memorized?
We teach about this stuff every semester, so it's really easy. I do have it memorized.
That would be amazing. Okay. I think I
have some questions.
Trichotillomania on there. Does somebody have that?
Yeah, that's what I was just gonna get. There's a lot of questions about phobias and if phobias are a trigger to anxiety, how to treat phobias, and then there is a question about trichomania as well.
So trichotillomania is what we would call it's a body focused repetitive behavior, so a BFRB. And so while looking for a therapist, you definitely would want to have somebody who's trained substantially with BFRBs. And all of those kinds of like skin picking, hair pulling, there's so many like it could be unique to the human, but they either can do two things. One is sometimes they're self-stimulating. So people will do that sometimes when they're bored, and sometimes they're self-soothing. So they do it when they're agitated. So the treatment is it's I want to say it's another acronym, HRT, habit reversal training. So you'd want to have those two acronyms associated with your whoever you decide to work with. I don't have training with BFRBs. I have very minimal training, I should say. And so I don't want to speak to it in great depth other than what I've just shared.
All right, folks. Thank you for that. So
Phobias?
did we cover books about anxiety? I know we covered a book about ACT, but did we talk about books to deal with anxiety already?
Well, it depends, I guess, on the kinds of anxiety that you're looking, So, I primarily work with like OCD and related anxiety disorders. So I really always recommend when a family member has OCD, because the treatment usually includes family members, and everybody has to be on the same team and understand how to implement ERP. Um, there's books by Jonathan Grayson and Abramowitz that are very good for OCD.
I guess it depends on what type of anxiety. So, Andrea, the question that you had asked maybe might be helpful if you could be more specific with what type of anxiety, and maybe we'll get back to Andrea's question. I know Inara asked a couple times in the chat here, what is GI distress? Gastrointestinal distress is what I'm assuming. Said on one of the slides, it says that it's a physical symptom of anxiety. What is GI distress?
Reflux or diarrhea?
Or nausea, vomiting.
Upper, lower.
Yeah, pain. Anything basically where, I mean, it doesn't necessarily have to be an output. More often than not, it is. More often than not, a lot of folks come to me with like IBS, for instance. So that's usually some sort of output there, but it could be even just pain. It could be, like I said, nausea, trouble eating. But going back to that nutrition question too, it's always kind of what comes first, chicken or egg. A lot of times, we could be dealing with something there. Was the anxiety causing the GI distress? Is maybe some GI issues causing anxiety? But it's definitely something that pops up a lot. So hopefully that covers it.
I go right to the diarrhea.
Yeah, that's mostly usually what it is, honestly. Which sounds like goofy, but I know for a lot of folks with IBS that I see with anxiety, it's very debilitating. So for sure, it's a big deal.
It's very uncomfortable.
Yeah.
Steve wants to know if anxiety problems are usually correlated with high ACEs scores.
Ah.
I like that.
I don't have the stats, but I'm sure. Are you talking about adverse childhood experiences?
Mm-hmm. Yeah, certainly with trauma.
Yeah.
Definitely.
I would assume with anxiety too.
I think the last study I read generalized it as basically the more ACEs, the more likely of a mental health condition, and anxiety is obviously in there. But that's not necessarily a direct correlation. I know too, like in that same study, they talked about protective factors, having like a trusted adult as a child, things like that. So if you're sitting there calculating like how many ACEs do I or someone I know have, it doesn't necessarily mean you have to have a mental health diagnosis as an adult. There are a lot of protective factors in there, which is a whole presentation in and of itself. But we do typically, I think based on what I last read, the more you have, typically the more likely you are to have struggles in adulthood.
Thank you. Kara, did we ask the question about trichotillomania?
What?
I know somebody diagnosed with, I only know how to pronounce it in Greek, folks. I'm sorry.
Oh yeah, they did it.
Okay. Trichotillomania.
Oh,
Okay. Another student here asked, if someone was not as receptive to thinking of somebody less fortunate as a way to distract, and if somebody would consider that like a weaponized type of deflection, how would we help that individual who might not respond well to that type of treatment, modality or prompt?
I'll funnel that one. So in DBT, we use a skill for distraction, and it's an acronym again, and it's accepts. And one of the C's is called comparisons. And I get that a lot, especially with my very empathetic teenagers who say, Kelly, I don't want to compare myself to someone less fortunate. That makes me feel worse. I don't like that. Absolutely. To which I say, let's flip it. How do you compare yourself to a time where maybe you struggled just as much as you are now, or even more than you have now? And can you compare yourself to, and use that example as kind of a reflective piece of you got through that, right? Or look at how well you're doing coping this time around, maybe versus how you coped the last time, right? So comparisons, when the godmother of DBT created it, her name's Marsha Linden, and she did say, yes, we want to compare to others less fortunate. But I do agree, as our societies become very empathetic, that can also be the adverse of that, unhelpful. So I say flip it, compare yourself to a time where maybe you struggled as well, and look at how better you're doing now than then, or reminding yourself, I got through it then, I could get through it now. It's again, one of those more helpful ways to distract.
I think that's a good point too. That the less fortunate part could be a little bit off-putting. I think even just being compassionate to strangers, like, if you're over in the Starbucks line and you pay for the person behind you, you don't know their circumstances, but you're just doing something kind for a stranger. And so those little things, I think, if as a self-care tip. But if none of that, although that works for you, take a look at the list. And that list is obviously not all inclusive. I'm sure you guys have some awesome ones that you've thought of on your own, and I'd be curious to hear.
Okay.
Sophia would like to know how should somebody seek mental health help without insurance?
It's a great question. So most hospitals provide free assessments. And I'm not saying the ER. Don't go to the emergency room or you're going to get an ER bill. But if you went to Linden Oaks and Mokina, what they provide is a level of care assessment for free. Last I heard, there might be some changes with Linden Oaks at least. So when you call, ask if there's a charge now. But that's what I'm saying is a really it's a very intertwined world, and it's hard to navigate on your own. So go to an expert, get an assessment. They're going to know the places that you can go without insurance. I know the places around here you can go without insurance. If anybody lives around here, Family Counseling Service in Aurora and Oswego takes unfunded and Medicaid and Medicare and all private pay insurance. So that's where you would go.
Metropolitan Family Services right here, right down the street from Moraine Valley, also takes individuals in those cases as well.
And oftentimes too, it's we call it like sliding scale. Basically, it's either no cost or very low cost, so affordable. No one wants to break the bank to get you help. That would be ideal.
Mm-hmm.
I also want to say that if you're really in a bad place and you need hospital-based care, they cannot deny you based on your ability to pay.
Mm-hmm.
So if you need to be in the hospital and you don't have insurance, you get to still go in the hospital.
That's cool. That's good to know. And if there's any students that are registered at Moraine Valley Community College, we have our counseling center here, and their phone number again is 708-974-5722. It gets covered with your tuition. Part of your tuition covers our counseling center. And so technically that is free, but or at least no extra cost outside of the tuition that you already pay. One of our colleagues has a student, Professor Hamilton has a student who would like an explanation on sleep hygiene.
Oh yeah. So this in and of itself is probably an entire other presentation, but the basics, right? Making sure so basically sleep hygiene, we use that word to mean a number of different things you can do to basically aid yourself in being able to go to sleep. And what that might look like are, well, first and foremost, we suggest get on a routine, basically, right? Make sure you're going to bed around the same time every night, getting up around the same time in the morning. You know, when you're, I think, later teens, early 20s, you're probably leaning more towards like 9 hours of sleep. We kind of come up with this 8 hours as the gold standard. If you're using, yeah, right, we all go, oh God,
High schoolers are supposed to get 9 to 11 hours of sleep a night.
they're like little babies again because their brains go through a whole other realm of development.
I'm going to tell my boss.
Yeah, we need more sleep, but seriously. And then other kind of tidbits for sleep hygiene, making sure the biggest one, honestly, shut electronics off at
Yes.
least an hour before you're trying to go to bed, which is ironic because most of us fall asleep looking at the phone, even with the blue light filter on. I know my husband thinks he's challenging a system by putting the blue light filter on, and I said, no, regardless, put the phone away an hour. There's, again, lots of research that basically says it puts us into an automated or an automatic kind of daytime arousal state. Basically our brain thinks it's daytime and it's not, it's nighttime. Other things that could be helpful, so bedtime routine, no phone,
Getting up at the same time,
Getting-
no napping during the day.
limiting caffeine a couple hours before bedtime.
That's what sleep hygiene is.
Yeah,
Because most of the time when
stuff.
people come to us, their sleep schedule is whack. So we need to work on like kind of adjusting it. And then, you know, with teens and young adults, we say on the weekends, splurge, stay up a little bit later. That's okay. But you know, if you want to start feeling better, sleep is one of the 3 best medicines.
Hey, George says that when he listens to talks like this, he wonders if it's realistic for him to have a career in this field and help people like you do, that he battles kind of doubts that he could do this, and just wanted to know your feedback on that.
Well, I think that's a really brave thing to say. And you know, none of us in this field, raise your hand if you're in this field and you've ever had imposter syndrome. Okay. So imposter syndrome makes you feel like you don't know what you're doing. And like, who am I to be telling other people how to feel better or all these skills? And so actually imposter syndrome is a good thing. They've actually done research around it.
Yep.
So if you question your ability to do this job, it means that you'll probably do this job very well.
Mhm.
The only people who don't get imposter syndrome are people who are not doing well at their job, or they are on the other end of the spectrum and they're killing it and they know they're killing it.
I would imagine though, with time and practice, right? I mean, you develop your skills, and as your clients get better, you know, then your sense of self-efficacy starts to go up over time. You know, I think anybody in the beginning of their career feels that way.
Mm-hmm. I
Heck
vividly,
yeah.
so speaking of your counseling center, I did my practicum in grad school at Columbia College in the city in the counseling center, working with students and like thinking back to that time, how insecure I felt. And you just grow in your career and you learn and you get more comfortable.
I mean, and I will say too, like, you'll never know everything, but you'll know something. And I think like knowing something and being able to own that piece and you know what, like, you know, over time be able to kind of enact that and figure it out. Like, there are people in our practice here, they talk about stuff in interventions. I'm like, what are you doing? I have no clue what that is, or, you know, all that. So it does feel at times like drinking out of a fire hose. But over time, I think you find your path. And I will say, like Courtney's vividly remembering experience. I remember being a psychology undergrad being like, what the heck am I going to do next? And if you would have told me all that time ago where I am today, I've been like, really? I'm going to do that? Cool. No clue. It's just one foot in front of the other.
And also just, you know, continuing education. We're required as clinicians to do like 30 hours of continuing ed every 2 years. And that's very helpful for staying on top of things. I think that, you know, the field is always changing and growing, and you just kind of have to try to keep up with it as best as you can. And also know there's also research just to indicate that the simple desire to be helpful is helpful.
Heck yeah.
And I always remind clinicians of that when they're having an imposter syndrome day. Just simply walk into that room with a desire to be helpful.
And what about job opportunities? Do you feel like there is a lot of opportunity out there in
Oh
this
my
field?
gosh, yes.
Yes.
Right now is probably the most robust time to work in the mental health field. There's a couple of reasons for it. One, as Nick mentioned, the statistics of people who are experiencing more severe mental health symptoms are coming in and wanting treatment. The other thing is that the field has kind of exploded with, I don't want to sound this, like kind of the corporatization of mental health. So I think that businesses or corporations have realized that it's lucrative, and so they are kind of building like around here, DuPage Medical Group, right, or Dooley as it's now called, or whatever your groups are. They they're starting to like hire clinicians, and so it's structured a little bit different. Our practice is much more like it's like we're in a home right now, essentially. That's how it feels. But so there's like lots of different ways to work and places to work: hospitals, private practices, community mental health. Although that's dwindling, unfortunately.
Yeah, state funding.
Mm.
People can always send their applications to Oswego Wellness.
I just hired somebody who went to Moraine Valley.
Hey, all right.
She starts next week.
Hopefully they have a good, solid foundation.
She's awesome.
That is really great. Do we have time for one more question? It is 12:30. And I want to be respectful of your time and everyone's time, or maybe we can just stop.
Whatever you want.
Well, let's say if a person engages in the coping mechanism, self-care, right? And it works a little bit. It works a few times, but then the efficacy stops. What can they do then?
We talked about this actually yesterday, where you need our brains like diversity. It provides vitality. So if you do the same thing over and over and over again and expect the same results, you're just not going to get it. Sometimes, a run is going to make me feel good. Sometimes a nap might make me feel good. So you kind of want to like have a repertoire of things that you're using.
Heck yeah. And then, yeah, switching it up, finding new things, which is also cool too. I think, Nick, you mentioned the word self-efficacy earlier, and part of like our general mental health and emotional health and all of that is trying new things and maybe not being great at them, but learning to get better at them, right? So there's always room for that growth, like Courtney was saying. We like to learn, we like to grow. It's what our brains do. When we start to get stuck, that's when problems happen. So.
Well, thank you. And that question was from Malak. Well, Courtney, Kelly, thank you again so much for an amazing presentation and for providing us with all these great tools that to manage our anxiety today and in the future, of course. And to the audience members, thank you all for taking part in our program today and for all the really great questions that you all asked in the Q&A. Again, we hope we can take this live in front of an audience again. We'll see what, hopefully the pandemic will continue kind of, the downturn. And that's going to conclude today's presentation. The only thing I might ask Courtney and Kelly, if there were probably a lot of questions we weren't able to get to. Would you guys be okay? Would you ladies be okay if you put your emails in the chat box? Perhaps some of our attendees might be able to ask a question or two. I don't know if you're okay with that.
I am, but I don't know where the chat box is.
Okay, if you tell me, I'll type it in.
Okay. So it's my first.
Did you have a slide with it?
Oh,
Did you have
yeah.
a slide? Go back to the
Is there a slide? Yeah, good call, Mark. Do we have a slide?
Do we have a slide with our emails?
I can't remember. Sorry, guys.
I don't think we did.
See, I'm not even like marketing my practice. Add it on there. So
Yeah, where's that chat box?
Courtney
no,
DeCarlo?
it's C DeCarlo.
Hold on, is this?
C DeCarlo?
Oh, we
C
found it.
D.
Here, I got it.
Okay, you got it? C DeCarlo at oswegowellness.com.org.
.com.
.com. I just put in both mine and Kelly's.
Okay. Yep. C DeCarlo at oswegowellness.com and K Olenski
Did everybody get it?
Yep, I think
Yes.
everybody got it. If you're in the chat, if you'd like, write
Is
down
it
those 2 email addresses.
So yes, feel free if you guys have further questions, reach out. We're available. We love doing these kinds of things and normalizing mental health and hopefully, you know, assisting somebody to kind of pushing them in the direction of getting some help if they're struggling. You don't have to struggle by yourself. So you can, there's help out there. So we appreciate you guys inviting us.
Thank you for the
Thank you
words.
so much.
Yeah, absolutely.
welcome.
Thank
It was
Thank you
amazing.
for
Thank
everything.
you.
This
Okay.
was phenomenal. I don't know how they're going to get better than this. I mean, each year they get better, but it's going to be hard to top this one. Thank you very much. Thank you again.
Bye guys.
Okay.
Thank you. Bye.
Have a
Thanks.
great rest of your week. Thank you.
You too.
Bye, everybody.